So we had really interesting talks during this session focused on the prodrome of MS, and some of it was based on the genetic susceptibility and environmental susceptibility that I just spoke about, how we can identify individuals that are at greater risk and study them prior to disease onset. Another talk focused on radiologically isolated syndrome and what that can tell us about the clinical onset of MS. We also had really interesting discussions about twin studies that are discordant for MS, so monozygotic twins, one has MS and the other does not. And when we study the twins that do not have MS, we can start seeing changes in their cerebral spinal fluid at the single cell RNA sequencing level and identify a subset of lymphocyte populations that seem to already be activated in that state, even though the individuals do not have MS. And then we also talked about the microbiome and how it may influence the onset not just of MS, but also of progression in MS, and how we can study that using mouse models and introducing age as an important variable in those mouse models as well. So the session really covered a lot of potential avenues that we can explore this further, and we are still some way from being able to bring this into the clinic. We know that MS has a low prevalence in the population, so being able to identify confidently individuals that are at high risk is a challenge. And then what do we do from there? Dr. Dieger also showed an interesting survey of people that do not yet have MS but are at greater risk, and whether they'd be interested in prevention trials, for example. And about half of them said that they would be interested. So there is certainly openness in the community of individuals that do not have MS but are at greater risk in participating in studies that could allow us to prevent the development of MS and cure MS.